So we've done testing in over 66 churches and over 50,000 community members and congregants for those faith-based organizations. And what we've learned is that it's really important to have a trusted leader in the community. Many of the faith-based leaders actually were the first to stand in line to get tested. And so it's now becoming a bi-directional sharing of information, sharing of education, and frankly, establishing in the long term an enduring relationship with that faith-based leader and that community. So I'm Debbie Salas-Lopez. I'm Senior Vice President of Community and Population Health at Northwell Health. Northwell Health's faith-based testing initiative is a partnership with local faith-based organizations throughout the New York Metro, Westchester, Nassau, and Suffolk County areas. And we're offering COVID-19 diagnostic testing and serology testing to community members. We're particularly focusing on areas that are underserved, poor, and communities of color that have access issues in terms of COVID testing. The initiative began in April, early May, when Governor Cuomo asked us to help support faith-based testing in underserved communities. So far, we've done COVID testing in our community in over 65 churches. We've tested over 50,000 community members for COVID. We knew that we had areas that were disproportionately affected by COVID. Our results are showing that in some boroughs we have over 50% positive serology tests, and that is different than the general population. These communities are essential workers. These communities are also suffer from other issues such as food insecurity, transportation barriers. They live with multiple household members, and some of them didn't have access to masks and access to education in terms of how to stay healthy. And so many of the communities we saw in our hospital, and we saw quite a few community members, came from areas that are densely populated. And transmission is much easier in densely populated areas. And housing insecurity is really one of those social determinants of health that's a real important issue to address. And COVID testing for us is not only, that's of course our first goal is to do COVID testing, but our ultimate goal is to develop enduring partnerships with these communities so that we're their healthcare provider. They think of us when they have health needs. We're also looking forward to establishing key partnerships in areas that were hard hit by COVID, so that in the future we work closely with these community leaders and these communities to provide the health and the healthcare needs the community has. We're continuing to do testing, not only in churches now, we're doing testing for first responders, we're doing testing for local government agencies, and so we're now forming partnerships, visiting some of our healthcare providers in the area, talking and visiting with local community-based organizations who provide social services, provide behavioral health services, which is also very important in the community, and of course provide access to care. One way that we're doing it is that we're screening our patients that come to us. We're using something we call the Social Determinants of Health Screener. We've now screened over 100,000 community members. And what we do is that we then refer them using a tool called NowPow. We now refer them, when we're aware that they have a social issue or a social concern, we refer them to the social agency in the community that addresses that issue, that can help them with that issue. And so we're looking to do more of that. Post-COVID now, we're scaling our community partnerships, and we are being very proactive about what we need to do to strengthen our partnerships across the communities we serve with social agencies that provide this kind of care and support to the community. In addition to the pandemic of COVID, there were other parallel pandemics, if you will, that just disproportionately accelerated issues in our community. One of them is unemployment rose. As a result, the pandemic of poverty got worse. We also saw the social injustices in our society and the pandemic of racism, and how all of those, the confluence of those three things caused a disproportionate effect in communities of color and in poor communities. We have a center here. It's a Center for Equity of Care. And we stepped up our efforts around having honest and transparent conversations with our Northwell colleagues and our Northwell team around equity and social justice. But we're also stepping those conversations up in the community so that we can have frank conversations about what do we do together? How can we work together to eliminate social injustice in our society? We have courses and we've implemented conversations, town hall conversations about unconscious bias and how that can affect the health and health outcomes of the people we take care of. Having open dialogue and open conversations and understanding where we have unconscious bias and what we can do about it is important across our society in general, but always in healthcare. And I think that we became a smaller world during this pandemic because the pandemic affected the entire world. Going forward, I think it's changed our relationships with each other locally, our relationships across the country, and our relationships across the world, because we have to work together to make a difference, and we have to work together so that we can solve for the problems that we now see with COVID.